to clean your mouth. We are streaming live on the social media platforms, Google Data Vision, LinkedIn, Facebook, Twitter, LinkedIn, so that you can learn with us, post your comments, experience, but also how best you've been cleaning your mouth or teeth, and then we shall be able to teach you better with our expert, Mr. Talema. Please go ahead and we start off. First of all, how should the mouth be without cleaning?
Exactly. But now, Mr. Daniel, what I wanted us to talk about first, you know, we are still in the oral health campaign.
Yes, please.
But then we find it's a very big parameter in trying to, the oral hygiene in oral health, because oral health means the well-being of our oral cavity, whereby our dear viewers out there, the oral cavity, like it has different parts.
Please
when you talk about the teeth, when you talk about oral hygiene, someone basically thinks about the teeth.
I know.
You get?
Me too.
But we are going to find that in this particular show that we have different parts in our mouth which all deserve care. Whereby maybe for our dear viewers who are able to see, today we managed to carry at least a model. This depicts what is in our oral cavity. But then maybe for emphasis, when we are trying to care about our teeth or our oral cavity, we are looking at caring for our tongue, we are caring for the gums, the yellow thing you see, our dears, which you can see, I think everyone can see here. Then we are seeing our teeth, we are seeing the palate, all those are intraoral structures. When we talk about oral hygiene, we are talking about all of them, but then there is also another aspect I wanted us to bring out before now we can see, because what I know, when someone tunes into such a program, is waiting to see, how do I brush? But then now that I wanted us to answer maybe 3 objectives in this particular show.
Please do.
The first objective we must achieve is, when do we brush? Because all those things matter. When do we brush? How do we brush? And what do we use to brush?
Very true.
Those basic 3.
And why do we brush?
I think we can now add on the 4th one.
Yes.
Why do we?
Yes.
Exactly. I think for that one.
And who should brush? Many people think that young children don't need to brush. Oh, when I have made 65 years, I don't need to brush.
Exactly. Now, maybe to start on that, who to brush? Because, as I told you, most people, when you take on a perspective of saying we have teeth, that like we brush teeth, that will now exclude those who have not developed teeth. Means they will not brush. But now we are talking about oral hygiene. It's not all about brushing. Even rinsing, you reach at a time and you find it's a way of what? Of cleaning. Let's now start from the primary point. Those who have not developed teeth.
Who should brush now?
Who should brush? Everyone must brush, must clean.
Everyone should brush.
Yeah, everyone should brush. I talk about the little kids at home. Someone you have fed someone maybe with the breast milk, that is the first meal, as we considered, before taking in any food which you think that maybe could be dirty, but then you find this breast milk is also enough to cause you oral problems, or to make you, someone say that you are not in a good oral state. Why do I say so? We normally recommend our mothers who are breastfeeding, get a piece of cloth, get somewhere, boil water very well. Then you soak in a piece of cloth.
Or a serviette.
Or a serviette. A serviette may not work, or it may dissolve. But then a piece of cloth, you pass it in around the gums of a child after breastfeeding. You get that will be enough to do the oral hygiene. That's necessary that someone must have the teeth we have just seen. I think now that one. Then when it comes to adults, that's obvious. We must, even the elderly who have lost teeth, they have to care for the what? For the oral cavity. Because I've told you the structures, internal structures are quite number. There is quite a number of them. So now what do we need to talk about the other 4 objectives?
We are still on who should brush.
Who? I told you it's a must for everyone. Those who are not, maybe the children can be helped by someone. The elderly,
the senior citizens,
they can be having also someone at home at least. There are those who are too old, 100 years. You have your judges there in village, but then they feel they have neglected their what? their oral cavity. But then in the oral health promotion campaign, it excludes none. Because oral health is for all. You get? That's the big point we have to get. But now, you also asked, why do we brush?
Why?
You added it on my basic 3 objectives. Let's first talk on all those ones we have brought in. Said, why should we brush? Our dear viewers, maybe for emphasis, let's realize that the bacteria which stay in our oral cavity, which are normal to be there, because they have their own duty, their functions, but now they also eat, they feed. Take a look, you have eaten food, it has stayed in your mouth or in your oral cavity, or that food that obviously gets attached in between your teeth or on the sides of the teeth, or on top of the teeth, either way. But then you find these bacteria also would love to enjoy on that food. Why do we brush? So that you can now remove that food that you have just put or that you have just attached on your tooth surfaces, so that the bacteria, by the time they want to feed on them, because for them to grow, they must do what? They must eat. So for you now to not to give it a space to grow, you must move that food immediately. That's very important. Immediately after the food. But now also we have some components in our saliva which help in, I can call it calcifying, like helping the food to get hard on the teeth surfaces. You have quite seen a number of people who open their mouth and you find there are some green substances, dark, black, they are attached on the teeth surface. It really means that was food that was supposed to be removed immediately, but then it was left there hanging, then it got calcified like this. We call it caliculus or plaque. So that's when you find we require those patients to come, and then we do the teeth cleaning, the professional dental cleaning. That's what we talk about, the scaling and polishing. But then while we are here now, we are trying to help those ones who have not had those things accumulate, not accumulate them. You get? That's why we are saying the basic reason of why we say brush your teeth is to remove those food particles from causing that caliculus and what? And plaque, or those dirty substances in your mouth. Then I think we are trying to, have you ever been jazzing with someone like the way you are with me here? But then you find I'm talking, but then you are trying to do like this. What does it show? There's what we call halitosis or bad smell. You can call it bad odor. Someone is talking, yes, it may not be very visible, maybe it's dirty teeth, but then someone is producing a what? Bad odor. It means, the teeth, as you are seeing, the teeth have those interdental spaces, a space between every tooth. It means it can harbor food. So what happens? Food gets decayed. What's the end result? A decomposition smells. Another thing, the teeth are going to get sick, and you find that the commonest teeth disease, it is called dental decay or tooth decay. At least we heard about that in P4, P5 when they were teaching us. So what does it mean? Decay causes bad smell. So someone opens the mouth, but then you find people are just touching here, signifying that what you're producing out is a dark smoke. It's not a white smoke. Exactly. So all those things we are doing them so that we can first of all smile nice. We call it aesthetics, but then it can also be called beauty. Smile like this, someone sees the teeth and then this lady is beautiful.
They
this guy is
ask you for a
handsome.
number.
You get it? There someone asks for a number, but then you find you talk, you can't be able to talk in public, reason being you see your teeth. Actually, most people don't know that we as dentists, we are able to clear those things in the teeth surfaces. So that's why we always come in, so that we can always at least encourage the public about all the awareness in their oral cavity. Mr. Kamara, allow us go into our basic objectives.
Before we go to the basic objectives, we want to first talk about the unattended to oral health. If we do not attend to our oral health, we talked about tooth decay, but we need to know other issues that could arise if we do not take this practical so serious, so that our viewers can see this practical as one of the most doable things and start immediately. So we need to look into the complications so that people can fully know why this is important.
Exactly. The first and major complication of neglected oral hygiene, I think that's the best way we can term it.
Yes.
Neglected oral hygiene, because you may find you are supposed to, but then you tend not to. So the first complication that happens, or the first problem that comes in, is tooth decay. This tooth decay, people, our dear viewers, what we call, for us, what we now later term as tooth decay is when you see an obvious hole in a tooth. Maybe it may be appearing dark or black, but then tooth decay starts. By the time tooth decay starts, for you are not seeing it. There is something like a chalk. It's not chalk. Chalk they used to use on blackboards. It appears on the tooth surface. For you keep scratching it off, you think all is well. Mostly it so happens, it's most common in the surfaces where we used to chew. We see some grooves and some deep fissures. That's why you normally see some dark substances. For you see it's normal, you think it's normal, but then it's never the case. But then coming back to what you asked about, the thing that can arise, the tooth decay can arise into many things without neglecting tooth loss. This tooth, the other time we were here discussing about that process of how the tooth eventually gets to painful. Our dear viewers, maybe just to do just a simple recap, we find that the tooth has basically 3 parts. The upper part, this outside, which you can see on the model, is the enamel. What you see, what you call, people normally call white or yellow substance. But then in most cases it appears a bit white, slightly white. Then that's when it gets sick, or when the tooth decay attacks that part, it does not have any pain. Then the tooth decay continues downwards. Our dear viewers, there is a middle part of the tooth, which is termed as dentin. That is the most sensitive part. And for the lucky ones, they visit our dental clinics to do what? For a checkup at that point, because they're telling you, when I take something cold or hot, I feel sensitive. When I take a mango, I feel my teeth are getting sensitive. What's wrong? That's when now the cavity or the tooth decay has bypassed the enamel, whereby I was talking about the chalky substance that appearing. The hole is just starting. It's not yet obvious. But then now, even when you're feeling sensitive, the hole is not yet obvious. Unless we check and we probe and find out there is actually what? A hole. Even holes can be in between the teeth. That's not obvious. You as a patient, you may not realize that you have a what? A hole. Then now a hole digs down into the roots. That's the pulp chamber, or where the blood vessels and nerves are located. So that's when that's the dangerous period, whereby you find you're having toothache. What do we do for toothache? Someone comes in a dental clinic, or someone goes for a camp, someone goes anywhere to see a dentist. They tell you the only solution is either to do root canal, which comes at a cost at most cases, and then another alternative is extraction, removing a tooth, which most people find easy. But then coming back to the complications, you have lost a tooth. You see, all these we are originating, it has an origin of bad or neglected oral hygiene. Reason being, having that calculus or the other hard substance that are attached on your tooth surfaces, the bacteria feed on that, and then there's an acid formed. An acid formed on the tooth surface. What does acid do? It burns. Even if you put acid, you pour acid here, it is going to corrode and burn that surface. So the same applies to the tooth surface. That acid formed from the neglected oral cavity after bacteria feeding on your food, which you left there some time back. It forms a hole, and now it goes through the other entire process I've been telling you about. So someone eventually loses the tooth. What are now the effects coming in? Someone is affected the speech. You have quite often seen people who have lost most of the front teeth. Someone cannot easily speak very well, because the reason being the tongue has no control. And then you find someone cannot smile very well, loses the social confidence. Someone cannot speak in public, cannot smile. Some people have lost to get loved ones. But then the good news is those teeth are replaceable. There is a modern dental technology whereby we can replace those missing teeth. I think that's the luckiest part. But then don't wait to first lose the tooth, because those teeth are not cheap. Getting another tooth, it comes at a cost. We are seeing it's all originating from a neglected oral hygiene.
Oral hygiene.
Yes. Then other things, they are quite different. They are quite many. If someone is getting problems with, I think you know better now. It comes to nutrition. Someone is failing to chew food very well. Reason being, the teeth, at least the major function, at least we may know, which you don't need to Google about. Teeth help us to chew, so that you can create the bolus and then everything and swallow very well. But now someone is failing, is missing some food nutrients. Someone is now telling you, I no longer take cassava. You see that, so now before you know it better. Someone tells you, I no longer bite sugar cane, but we know the sugar cane is very important in our body. Someone tells you, now I resorted to maybe soft foods, but also too much of them won't do you good.
Exactly.
You need to mix up. So there are quite a big number of them, but for interest of time, let's now.
We want to thank you so much. Thank you so much, Edwin. And of course, our viewers want to thank you for joining us and for accepting to watch Health and Beauty program, and inviting you to always watch Google Data Vision at all times in your sitting room, in your bedroom. Bring the screen closer to yourself, to your family, so that you can enjoy our programs that are Christian lifestyle and are intended to change your life positively. Now, of course, we want us now to talk about the oral health among young children. Mr. Taremwa, we cannot ignore the oral health among young children. Speak some of the dilemmas and your experiences. The children are losing many teeth, and of recent I've realized that most young children, they take longer to have the permanent teeth coming. I don't know, what is the common challenge now?
The common challenge now is, in fact, it's a myth. I think we need to now get time and they will come and we exhaust about the myth in dentistry. But then people have found it like they think the children's or the milk teeth are not supposed to be treated. Or someone takes it like good enough, there is another tooth coming.
Exactly.
So even if I lose this, it's well and good. That's the issue we are talking about. Some people lose teeth and then they find it takes time for the other teeth to come. What is the science behind? You see these milk teeth. Whenever you see a milk tooth, there is underneath it, there is a permanent tooth coming. And it's this milk tooth that gives orientation or gives direction. The other tooth down coming, but now take a look, you have removed the tooth at maybe due to neglected oral hygiene, or it gets toothed, obviously you end up removing it. Because you find the challenge is, in children, we don't do root canals. Reason being, their roots, they keep resorbing physiologically. That's how God created it. When when the tooth of a child gets the painful stage, the only solution is to remove. But now you have removed that tooth, it means you have removed it because of a disease. It was not its time for it to get out or to shed. It's called the shedding time. So when you remove a tooth before its shedding period, it means, our dear viewers, the shedding period is this, whereby you find that God created those our teeth, our milk teeth, in a way physiologically under normal circumstances. They are supposed to keep resorbing the roots. They keep shrinking off, so that they create a way of the other permanent teeth coming down. But now you have neglected your oral hygiene or no, oral hygiene of your child, and then someone has lost a tooth. Those are the likelihoods of finding that the teeth that are coming, which are permanent, if you are lucky enough and they come in the right direction, but then they come maybe when they are big, or there are these malalignments. Someone gets these canine when they are blacked out. Because I told you the major purpose of a milk tooth is to give orientation or direction of a permanent tooth coming downwards. You get that's the challenge whereby you find most. In fact, it's a trend. Most parents are opting for braces. You have seen at least children of above 12 years, 13 years, they are telling you, I want braces. Reason being, the things we neglected at first are causing us to pay millions of money.
For us, we thought it's a trend. Having braces
is not a design. It's something designed to correct the alignment of the teeth. You get, so that you enjoy the other benefits. I was thinking about the smiling, talking, everything. Because you take a look, you are meeting someone who has crooked teeth that they are facing outwards. They will just put them to do what? To correct. But then all issues are coming from failure to buy a toothbrush, failure to get toothpaste, and failure to use it, because it's also very important.
Excellent points from Mr. Tarema Edwin. Mr. Tarema Edwin is an expert dental officer, and of course he's giving us his expertise and his experience here with us at Health and Beauty Program. We are learning a lot when it comes to oral health, and he's telling us that your mouth is your identity. I mean, when you speak, you smile, God will be pleased, yes, because I want to encourage you to visit our social media platforms, Greater Vision Uganda, TikTok, Facebook, LinkedIn, so that you can enjoy this program, but also go ahead and put your comments so that you can learn better with us. We'll take a short quick break, but when we return, we shall go into practical how best to clean your mouth using a toothbrush, which toothpaste should you look out for, and how should you move your toothbrush in your oral cavity. See you shortly.
Good Day TV, transforming your life.
Omulabi wa Good Day TV, Sunday yo tujongeddemu ebirungo. Tosuba program our vows. Ekyamazima ogenda kunyumirwa emikolo omuli okwanjula, embaga wamu n'okumanya ebipya eri gwateekateeka omukolo.
Obufumbo obulungi, obufumbo bwa muwendo, obufumbo bwa kitiibwa, ababiri bafuuka omu, lubereberye 224.
Obufumbo ky'ekigambo eky'ekitiibwa kyalagirwa Katonda ng'abantu bannaba kwonoona.
Ebimu ku bipya by'ogenda okumanya mwe muli ddiko ow'omulembe, ennyambala eriko n'ebirala bingi. Buli lwa Sande essaawa 12 ez'akawungeezi, nange Nanseyeko Tabitha Matovu.
Don't miss on Guguda TV. Good Day TV, transforming your life.
Your mouth is your identity, and of course it contributes to your face print, but also it helps you to have the public confidence to speak. And of course your being is nourished, yes. And of course I want to say that we are entering a practical with Mr. Tarema Edwin, who is going to teach us how to brush our mouth very well. I want to be very keen and watch so that if I've been doing any mistake, I stop today. Dear viewers, welcome from a short quick break. Let's go into a practical with Mr. Edwin.
Thank you so much, Mr. Kamara. You've said, for us we say, our mouth is our mirror, is a mirror. When you have a bad mouth, you are depicting what people are seeing. It's a different thing. So you're smelling bad, your mirror is showing something now not good.
Isn't that one integrity?
All right, let's go into now the practical part of it. But then there are some things I told you that we must know.
Please do.
The 3 basic objectives. When do we brush? What do we use to brush? At least let's first know those. When? The objective of when. At least if we achieve that, it's very simple. And then what I will request for our dear viewers is like, let's now neglect the ones we have been knowing. Let's know. The people, this mama Ijaja told me I should use this, but now here we are. When do we brush? The Minister of Health recommends or gives guidance to brush twice a day. twice a day. When you tell someone twice a day, because we normally interact with patients, tell them, when do you brush? So it's twice or thrice. When, ask the person when exactly, in the morning and evening, but that's wrong. The best timing for brushing is in the morning after taking breakfast. For those, this is the point to note, for those who expect breakfast, because we shouldn't be much theoretical. There are some people who don't have a breakfast.
Please go ahead and brush.
You understand? Just wake up and brush. If you don't expect any breakfast ahead of you, maybe due to some factors, you understand. But then I'm now saying someone who expects a breakfast meal, that first meal we have in the morning, first have that breakfast done, and then you do the cleaning. I think that point is now taken. Then another issue is during lunchtime, after lunch. Some people who can try, they normally do the brushing. But then the two times we recommend, the lunchtime is not there. Lunchtime rinse you with water and then spit. That's enough.
Personally, I can't manage moving with a brush every day.
That's it was found that it is inconvenient for the biggest population.
Being a perfectionist.
Exactly. Then another timing is before bed. You get? Because another mistake people do is that after supper. We have people after supper who go now for beer. After supper, people go for snacks. That one would be a wrong timing.
For birthdays.
You understand? But now the best time we are saying before bed. You are done. We are considering that you are done with whatever food you wanted to take during the day. Now you are going to do what? To sleep. You brush. Now what am I trying to bring about? Someone who has brushed while you're going to bed, it's most likely that that person will wake up with a fresh mouth. Because if we had open questions for our dear viewers, someone would ask you, what if I get a visitor in the morning? You get? Won't I wake up with a bad smell? But no, at night you're not going to be eating anything. All you're going to do is to have a rest. And then in the morning, you wake up with a fresh mouth because you slept when the food you had just eaten at supper, you had already brushed it. So it's not there, so maybe it has decomposed and it has produced that bad smell. So you wake up with a fresh mouth, have your breakfast, do what? Brush. Maybe go for your work or do other activities. I think that's, for interest of time, we have understood.
Before you go away from that, I have heard people that when you brush before bedtime, you should not rinse your mouth. You should leave the toothpaste in the mouth. It's
actually, you see, just because in the I call it an African way, but then when you have to see the best way of applying fluoride, this is the content in the toothpaste. People, it is always advised that you brush with a bare brush, then you now apply, you paint it with the toothpaste. Then you just leave it there for like 2-3 minutes. That's the best of toothpaste of fluoride application. But now, whenever we teach masses, that feels like it's a more modern.
Wasting time.
What? But then let's now what we normally focus on is at least let the biggest population do the bare minimum. What you're talking about is the best. Putting toothpaste and then, but for you brought it, but after brushing, you don't rinse. You leave that you are leaving in the mouth, which is, first of all, when you are brushing, there was food still inside. You must rinse. That's not proper. But then the proper thing is using a toothbrush, which is not having a toothpaste, and then you can, that's for those who can manage, our dear viewers. Still using a brush which contains toothpaste on it, it's still fine, though it's not the best. But then at least if you are considering, we say that if at least a biggest population can do that, at least our oral health campaign can reach at a certain point. So at least we can consider that at that point.
Wow.
But it's nice, it's always recommended after brushing, rinse. Because there is dirt, you have moved on the tongue, in the cheeks, on the gum, in the teeth. It's always good to spit it out and not swallow it.
Perfect. Thank you so much, Mr. Tarima. Please kindly take us through on how to brush.
Now that was on what to use to brush. That was on when.
Yes, now
but now let's now go to what to use.
Yes.
Exactly. So, our dear viewers, we find that mere toothbrushing, it doesn't take 100%. to ensure that your oral hygiene is proper. It takes, in fact, it takes about, research says it's about 60 to 65%. Because we realize that when you are brushing, you brush on the visible parts of the tooth, or the brush has specific parts it cannot reach. I was talking about the interdental spaces. So someone out there should not think that mere brushing can take it all. We have flossing. I'm going to come to that when we come to the practical part. But flossing is a thread you use in between your teeth to remove the food that is stuck in between the teeth. That you can have the other 100% completed for the oral hygiene. But now what do we use? Our dear viewers have carried along. I don't know whether maybe the camera can focus on this, but then at least our dear viewers, if I would have a question interlude, I would ask what are the differences, or even if it's you for you are nearby, are you able to see any difference?
Yes, see the difference.
Other than the color. Let's now exclude the color. Well, that's an obvious difference.
Yes.
But then, maybe for the interest of time, we are seeing this brush, the bristles, these are things that we use to brush our teeth. These ones are separated.
They are old.
They are old. Another thing, another obvious thing, they are hard. I'm comparing to these two. These two are the same, just because of the different type. Our dear viewers, what I want us to get clear, I'm not here to market any brand, but I'm marketing the nature of how they are made. Now it's now about you. Having seen, you can now go on the market and look for your best brush. People have always had a tendency in brushing hard, brush is nice. No. It's never the case. You get, that's what is in the people's minds. That when you someone, that's why you hear someone brushing, you hear quack, 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 quack. Someone is trying to brush hard, go hard. Yeah, you said this is a practical thing now.
Please guide.
So we are saying these are soft bristled. Even if you are at sea, they are very soft. Reason being, it's supposed to remove the food you have just eaten. That food is still soft. You don't have to use a lot of energy, and neither do you have to use a hard thing. These brushes are meant to scratch other things.
Brush shoes.
Brush shoes, clear all the hard substances. Yeah. Then we have now understood the toothbrush that you are supposed to use. It should not be hard and it should be soft. Then this one, another first characteristic I brought, the bristles are worn out. It means it has been used for so long. You ask someone was saying it's a month of July. Someone is expected to have used at least 3 toothbrushes. But someone was like, you are saying 4, yet I have the one of last year. You get? So it's recommended to use this toothbrush for maximum 3 months.
Depending on how you use it.
Not depending on how you use it. For you, you may think that 3 months I've used it, but it's still okay.
But some use it vigorously and the bristles run out.
You understand? But now if you use it in 1 month, but now even after this program, we are going to find that even those who have been using it vigorously are not going to be using it anymore because it's not proper. Yes. We are going to see on how best we can brush. I think that will be also answered. Then 3 months, it's okay. Another important thing on it, the economical function of it. The hard brushes are expensive. These brushes are for 500 each. The soft ones, 500 which shillings? Are very important. 500 shillings, Ugandan shillings. The maximum it can go to 800 syringes. You get? So let's now, that's why I'm taking it away now, this one. It's not important. You understand? Because we are on the objective of what do we use. I've carried along with, I told you I'm not marketing any brand, but it's an example because it's on market, readily available. I've carried myself. This is one, in fact, I picked the one I use at home. It's okay because it's on market and it's effective. So the toothpaste, the only thing you are looking at is the fluoride content. If you read very well, it must be there. You see this one, total fluoride content, they put the amount. So the amount now for you, it may not, as a layman, you may not go into much science of how many milligrams did they put, how many parts per minute have they put. No, at least the easiest you can read is there is fluoride content. Just like you can go to buy any brand and they tell you, there is a certain characteristic you must look at. Even if you are going to buy a TV, they tell you, you must look for this. So this is what you must look at in a toothpaste. whether you are buying Colgate or any brand, but then does it have fluoride? And it's evident that people who are selling these products in unauthorized places, maybe which are not certified by the URSB, UNBS, yeah. You find they have those toothpaste. Maybe you find someone has laid them there outside his home. He tells you maybe someone is in bus. Tells this one takes away the holes. Find the time, go to the shop. There are these shops you normally see, supermarkets. Go there and pass by. Just 2,000, get one. I think now we have understood. The toothpaste must have fluoride, and the toothbrush must be soft and not exceed 3 months. You get? For our children, the children, I didn't carry one, but for them they are always smaller in size. Soft and smaller. Reason being, it's enough to tackle their tooth parts.
And with cartoons.
With cartoons, they like them, and it's better someone using something that he or she likes. Then we also have the dental floss. How dear viewers, this is something like a whole packet contains 30, and then it's on market it's at the most 3,000, but it's mostly 2,000. You get? You can get it in supermarkets, in pharmacies, they are all there. But then these are disposables. Use once and discard. Where do we use it? In the space in between the teeth. We are going to see it on our next objective. I do think that's enough on what to use. When I say we are using a toothbrush, this one removes all it puts down all questions of me. I use the stick, I've been using charcoal, what. My mom told me use some herbal things. There are some herbal leaves they use. For us, we used to call them ekarwe. All those now, because all those things, they corrode the tooth surface. You get? It ends up now getting like those cavities or getting worn out. Then you enter into the deeper parts of the tooth. Let's now go to how.
Yes.
This is our last objective.
Yes, how to do brushing.
How to do brushing. I told you that this is a model, but then it shows exactly what you have in your mouth. Because as you are seeing, it has a tongue, it has the palate, it has the teeth. So we have agreed that we are going to use the common way of having your water. For the children, it's a key point. Children, it's always we always recommend to give them water which is boiled. Reason being, for them, they have a tendency of swallowing accidentally. But for you, you can voluntarily control it and you say, I'm going to spit out after brushing. So that was a take home. Now let's go into the practical part of it. We said let's do a local way of putting some toothpaste. There's something I didn't talk about, something very small, just a minute. You have said it's a practical thing. People have a tendency of, after opening the toothpaste like this, they have a tendency of putting toothpaste like this. Someone thinks I'm going to do what? To brush. The toothpaste is covering the whole brush. This is too much. I told you this thing has a fluoride content. You are applying now too much. Just like the way you can be talking to people about the nutrition thing, then you tell someone, if possible, take 3 pumpkins in a day. That's something of no importance. So we normally recommend a pea size. Our dear viewers, I think we all know pea. For those who don't know pea, call it kawo in Uganda. In Angola it's called obushaza. Not so? So we're going to see the pea size. Size ya kawo. Something small like this is enough. You don't need something like this that I put, maybe for comparison. I think we can easily see the difference. So on the part of what to use, we are saying put a pea-sized toothpaste. It's enough. Now you rinse, not rinse, but you pass on running water. Or you can get the water and put it in a cup. It's well. Dip it and then you now come to, this is now the practical part of it, on how to brush. I've said this is I call it my mouth or your mouth out there. It's always better, or we always recommend that you brush You start brushing when the teeth are closed like this. You get? There is a reason being until we are like the method I'm going to teach. You are like to find that you are brushing both jaws at a go. So they recommended, what we don't recommend, or what people do out there, is the thing of you get of let's be practical now. This is not what is done. Neither do we do this, because this is people find, I don't know where people find it very easy, but then it's what is commonly being done, but it's never the case. Listen to me. You have put your toothpaste, you have dipped it in water, or you have put it in running water. Then just as you have been doing always, but now the mistake has been on how you remove your brush. Never be hard. Let's be gentle. Supposed to be gentle. That when you attach a toothbrush like this, it's supposed to attach to around 2 to 3 teeth. Depending on the size of the teeth, they are not the same. But now on my model, I see it is getting attached to 2 teeth. Then let's be gentle. Such gentle motions. The teeth you attach to, don't leave them before 10 times. We are counting 1, 2, 3 until 10. Those 10 round circular motions. Gentle, not hard. You may do the right motions, but when you are being hard, you are damaging the gum. Whereby you're going to see people finding they have tooth gum recession, the gum is getting out like this. Then the tooth starts shaking. You are the one doing bad to yourself. Then now you come to the next part of the teeth you are not touched on. Remember the other first ones you had to do 10 times. That's a principle. You must at least achieve 10 times motions. Come to the next part. Continue until you reach this side. Remember the mouth is still closed. Actually, when you do it practically, you feel it's now more easier than what you have been doing. 10 times this side. Now you open. Try to open your mouth like this. Don't have to open too much. When you open your mouth like this, our dear viewers, you're like to see. You're like to see there are grooves, the ones I was telling you. Mostly in these behind teeth, from this first premolar until the last molar. You're like to see the grooves, or what you can call like holes. Those deep pits and fissures. You find now the technique changes from round. Now the one you have been doing in the sides, which I told you that it was wrong, this one of kwa. Now you come and do it here. On these parts with
because of the ridges.
Those ridges, those holes that are on the tooth. Front, back, forth, 10 times. It's still the principle we follow. You can this side, the teeth of this side also have those holes. Do the same thing 10 times. Do the same thing here 10 times, and this side. You see? Now you come to, our dear viewers, you come to the teeth which are in front. Remember outside we had brushed the normal way when they are still closed.
Yes.
But inside, it's not yet clean. Inside now we do like this. From inside, outwards. You get? 10 times the principle. Don't leave them without reaching 10 times, at least. For those who have time, it's not bad to do 20. Good enough, it's for your own good. You get? Then you come up, the upper teeth. Also from inside, outwards. This style is designed to not cause harm, the gum, underlying gum. Because when you do like this, it will be taking it back. It means you have, first of all, you're opening it for food, for the dirt being inserted in. But when you follow this motion, you find you are not doing any opposition to the gum alignment. Then you come to the inside part. It's so unlucky that, it's so unfortunate that my model has a big tongue. Had it not, let's use the upper part, because there is no tongue. The upper part, we find that outside we had already cleaned, but then the the inner part towards the palate. You do round. The circular motion you are doing outside, now you do it gently from inside. 10 times the teeth you attach on. Continue and reach here, because these front ones you had already cleaned them using this motion. Then now you stop on this premolar and then come this side, gentle, 8 times. Even down, just because the tongue, this model has a big tongue, but then the brush would also be fixing itself there. Do gentle circular motions, and then people will think they are done. That's where most of us normally stop. But then the tongue, it has also been having dirt. There are those tongue scrapers, I think I didn't carry one. but then they also are supposed to be on the materials we use. But then if you don't have it, we are already using a gentle brush with soft bristles. Kindly do from inside outwards. 10 times. For the tongue, when you have a mirror, you can not gauge the time. You may even see, keep opening the tongue and you see, is it clean enough? Those white substances, have they left? Open, I mean from inside outwards. There is normally this vomiting reflex we cause when you go a bit deep behind. You feel like vomiting. It's well, first pause. Don't neglect it. Instead pause and then resume. Because that reflex will have gone. Part outside. One more last thing, which I want to explain. Use a tongue for eating.
The mouth is for eating.
Exactly.
Wow, very interesting discussion. I've been so careful, and I must say that cleaning the mouth goes just beyond the way we've been doing it. And I have to agree that from today we need to do the correct way of brushing. We want now to learn how to use a tooth floss.
So, our dear viewers, I think this is the one thing that I showed you that I didn't show you how to use it. This floss is capable of going in between any space between the teeth. Some people normally say my teeth are compacted. At least God didn't create you with teeth which are bound together like this. It must have that space, even if it's not visible. But then fixing it in like this. That's because this is a model which was practically made when they are attached together. But your teeth must bear that space in between. So this one I told you that when you just do the brushing, you have not done enough to your teeth. You have already cleaned them for until like 65% or 60%. But then to achieve the rest 35%, you have to
use a floss.
Use a floss.
Wow.
In between, because this one you'll find it's going to remove the interdental food debris that had got attached in there. For those who can't manage using it daily, at least try it. When you take meat, when you take mangoes, there are those obvious things that we know that they normally attach. Leave alone the issue of toothpicks. They damage your gum. This is just a thread. Pass it in between. Thank you.
Perfect. Thank you so much, Mr. Tarema. It's been a very nice learning environment. And of course, do you have any last remarks to our viewers in bid to manage time?
The very last remark is maybe ensuring that or encouraging our dear viewers to come for dental checkups.
How many times?
At least twice in a year, after every 6 months. Count yourself. Don't wait for problems. You get? That's the very last, because most things will start from there. Visit a dentist and avoid the things of asking your colleagues, when they removed your tooth, what did you feel? That person will get, maybe didn't follow the post-operative instructions, maybe got a swollen cheek. Then that person will tell you, and then you find that, I will not go. You get?
Do you have any regards?
I remain Taremo Edwin, Victory from Victory Medical Clinic, that's in Entebbe, Katare Seguku. And then the regards I would make are to my colleagues. My best friend, that is Manya Redian, is down there doing her jobs and moving on with life.
Perfect. We want to thank you so much, Mr. Tarema Edwin. It's amazing to have you. And for Health and Beauty program, our viewers have fully learned a lot from your expertise and experience. We hope that this is put into practice because we are preventing diseases. Around 75% of health conditions in Uganda are still preventable. Colleagues, friends, families, let's take this information so serious from the expert. I want to thank you for being with us since we started at 8 p.m. till now. And of course, I want to say I love you so much and I look forward to seeing you next week on Wednesday, 8-9 p.m. Take care of yourselves. God bless you.